Today we'll talk about a disease process that we see fairly commonly in the colorectal office and the proctology clinic, and that is the disease associated with perianal fistula. A perianal fistula is an abnormal connection that develops from within the anal canal out to the skin around it. This obviously then becomes quite symptomatic because you have bacteria and stool from within the anal canal that gets into sterile soft tissue around the anal canal, which will then cause infection in that area, which may spontaneously drain or may need to be drained by a surgeon in the office. Regardless of what happens, the treatment for this is to close off the internal opening of the fistula tract. Once the internal opening is closed off, then you don't have persistent contamination of the sterile tissue with bacteria and stool, and the entire process can resolve. Closing of the internal opening, however, is something that takes a fair bit of skill and does not always work. Much depends upon what the cause of the fistula is. The most common cause is something called a cryptoglandular fistula, but other causes also need to be ruled out, and if those are in play, they need to be treated before the fistula can be treated. Other causes could include radiation-related damage. There could be underlying malignancy. You can have an inflammatory process associated with an inflammatory bowel disease that can result in a fistula, which almost always points to Crohn's disease as an underlying process. Whatever is causing severe inflammation on the inside, that inflammation needs to be controlled before the tissue can be repaired. And while that inflammation is being controlled with medications, the fistula tract itself needs to be controlled so that whatever contamination occurs through the internal opening can be drained. Often this requires placement of a drain or a ceton, which is done as an outpatient procedure under anesthesia. And after that process is performed, then the patient works closely with the colorectal surgeon and potentially the gastroenterologist to get all of the tissue in that area to be infection-free and healthy. And only once the tissue is not infected and not inflamed and is healthy can we do things to try to repair the tissue so that the fistula tract resolves. Now, fortunately, most individuals never have to deal with this process. However, it is fairly common for a proctologist to have to deal with this process, and in our clinic we often see anywhere from 2 to 5 or 2 to 6 individuals come in with this process on a weekly basis.